Seattle. The premise that Reich introduced was that one does not talk about successes or the positive outcomes of therapy. You bring in problems. So actually, I teased Bob Teeger about being a problem case. You brought your patients to Dr. Reich if you were doing consultations only because you were having a problem. And Dr. Sobey would often anecdotally account, you bring your patient who you were having a problem with to Dr. Reich, of course, and he would spend 5-10 minutes and say, well, here's the problem. And he would do, and he would say, why didn't I see that? And Dr. Reich, in great generosity, would say, you didn't see that because you're not as trained or as capable as I am, and I've been doing it longer, and I'm more qualified. But you'll get there. You come to me because you have a problem, and you learn. And so what emerged was initially the work known as character analysis. And this is, I'm recently with one of my students, we're about 3/4 of the way through character analysis, and if you've never read it page by page, it's a wonderful thing to do if you have people who you can do it with, to read it page by page out loud with each other and talk about it as you go along. It's take a couple of years, but it's okay. So what emerges there is character analysis, even in its final editions, is very, very strongly rooted in psychoanalysis and in traditional psychoanalysis. But he's already beginning to push the boundaries of psychoanalysis and psychoanalytic practice and psychoanalytic theory, much, in some ways, less theory than practice. What it gets clear as you read even the last edition of character analysis, which is clearly already moved into and been influenced by 1944 by the developments of Reich's work that have pulled him away from mainstream psychoanalysis, is character analysis, at least until the last part of character analysis, the infamous third part, which we'll get to in a minute, it is how strongly rooted his discussions and his examples and his case studies are in psychoanalytic practice, and how much psychoanalysis or the constrictions of or the parameters of psychoanalysis form how and what treatment should be, right? What is also fascinating, it seems to me, as you read this, is you begin to see clearly, even before he introduces the concept of energy, and particularly of orgone energy, that in the earliest formulations, Reich is uncomfortable with just verbal, intellectual examination of the underlying problems of psychodynamic problems of a patient's pathology. And that often in discussion he gets to a point where he feels limited, or the discussion is limited because it can't go far enough or deep enough into what is really preventing the patient from breaking through or coming through or resolving. Don't forget, traditionally, certainly in the 1930s and into the 40s, Dr. Weitzman will address this today, but in Freud's terms, intellectual insight and understanding was the key process for working through or resolving the neurosis. Reich increasingly came up with that not only in the seminars but in his examination of patients, his work with patients, that this just simply wasn't the case, and that he gives often examples of patients who start out with phenomenal insight into exactly why historically and intellectually they're in the position they're in, and you don't get any place. So already with character analysis, he begins to realize that there are these incredible things that go on in the room, in the one-to-one relationship, in the interpersonal relationship with the patient, and that in itself is a unique beginning of a unique quality of Reich's work, which is he becomes increasingly interested, more than Freud or almost any of the others, in the idea of the interpersonal relationship between the patient and the therapist. And by interpersonal, we don't mean just countertransferential. there's a very strong sense when you read Reich at this early stage that he's getting increasingly interested in what happens between the physical presence of the therapist and the physical presence of the patient in the activity of therapy. And what this does is it brings him literally around the couch. So he makes a major deviation, which is he moves from behind the patient in a more passive position, which had become traditional with Freud. You also, many of you have heard this many times, some of you might for the first time. You have to understand that the traditional psychoanalytic position behind the couch, right, behind the patient, was an innovation of Freud's, mainly an adjustment for the fact that Freud could not stand facing his patients. We have this in writing, in Freud's journals and letters. Talks about how he couldn't stand looking at his patients when he talked to them. Plus, he would get
to see when he fell asleep.
Right. That was the next thing, and that he would often get bored or distracted and didn't want that to interfere with the patient's ongoing flow.
He didn't want to see his reactions.
Right, or his reactions, but often his reactions were, and along with that, there was the again, official orthodox view that a session was 50 minutes, the so-called, notorious 50-minute hour, which I think was one of the first books I read on psychoanalysis, a famous book called The 50-Minute Hour. That was also developed because Freud simply found that he could not go past 50 minutes. That was the limit of what he could tolerate being in,
He did it 7 days a week.
Yeah, that's true. In fairness,
and then 6.
Yeah. But these kinds of stylistic innovations became critical. Reich, on the other hand, began to feel that these were, and had the courage, in a sense, to say, why do we have to do it that way? Or I can't do it that way. And he began to make alterations. The key alteration was moving from behind the patient to basically on the side of the patient. And in doing so, what he discovered, I think, very, very critically, was that by doing that, interesting, changed your perspective, and you saw things about the patient that you couldn't see from when you were sitting behind them. And one of the things that you began to see was their physical, presentation on the couch, and their physical activity and their characteristic ways of behaving as they interacted and did their free association in the more traditional sense. Gradually during this period of time, he also begins to become aware of the fact that every patient presents a characteristic way of behaving, and that if you keep banging, he literally uses the word banging away, hitting away at that characteristic way of behaving, eventually patients will break down or break through, or some combination of both, if you're successful, and they will begin to reveal more and more about what is deeply hidden and deeply repressed and inaccessible. And that more significantly, and this is what began to get him in trouble even then, it happened faster. It happened faster than the more traditional psychoanalytic practice of the time in terms of strict free association. But this was a violation of some of the primary rules. This meant greater presence, greater interference. But even so, at this time, Reich was not yet willing to cross that boundary in which he actively went after the patient where they were. Right? So he was getting closer to that. And so in character analysis, you begin to get the articulation of the fact that what you need to do is interpret what is to stay focused on behavior, to stay focused on the details of the way the individual behaves and presents themselves, and then to stay focused specifically on the defenses and resistances that the patient constantly presents, and following the intricate ways that they will elaborate and maintain those defenses. And his view becomes increasingly articulated that if you keep doing that, eventually the patient, in a sense, will become trapped in their own